One of the things we realized in looking at our facility-based model was that despite our best intentions, the participation rate among patients was quite limited.
Patients who are referred for cardiac rehab programs, well, we know from the literature that if they participate in a cardiac rehab program, they are about 25% less likely to be readmitted. But we know from our research that only about 15% of patients that are referred for cardiac rehab actually complete the program.
So we looked at an alternative model, and that is our virtual cardiac rehabilitation program.
With this option, we're able to capture that population that we couldn't get to us because of transportation. The facility wasn't close enough to them. So participation rate has been huge, and with us getting our hands on them in this virtual cardiac rehab sooner, again, we're just preventing readmissions and doing the right thing for the patient.
I would describe this virtual cardiac rehab program as something that is an alternative to the in-person option. A participant can have available to them 24/7, something they can roll in conveniently that goes with them in their smartphone. They can then participate at home at any time that they're able.
I think a lot of patients, when you offer them cardiac rehab, come back and say that, I could do it myself. And I always tell them that, this is just more than just exercise and more than just, increasing your activities. It's about a whole lifestyle change, and that cardiac rehab provides that foundation for that lifestyle change.
We have had wonderful feedback from our patients. They like the fact that there is personalization. They like the fact there is accessibility to the coach. Our results have shown that all the benefits of cardiac rehab, including quality of life benefits in terms of counseling, behavioral modification. You are making it convenient for the patient, giving them the personalized attention. You're also seeing the results.
I actually had the opportunity to speak on the phone to a number of our patients that participated in the program. One of the number one ways the program helped them to achieve their goals was by providing them that daily support through the app and through their care manager that really helped them to feel motivated, to know that somebody was managing their care, and to meet them where they were at after their qualifying event. The program really gave the patients confidence, but the tools to complete cardiac rehab and to improve their health.
So the impact of COVID on facility-based cardiac rehab was detrimental. We had to shut facilities down for 3 months. So it was great to have the virtual cardiac rehab in place right before that hit. It was like a godsend for us in that we were able to take the patients from the brick and mortar facility, not interrupt their care, and get them transferred into the virtual cardiac rehab program. So it was wonderful.
So we've seen a number of great outcomes with the virtual cardiac rehab program. Patients are happy, they enjoy the program, they interact well with it, and they've achieved their goals of getting stronger and have continued those goals even past the completion of the program.
We always want the best for our patients. You want to keep them well, you want to keep them healthy, you want to keep them out of the hospital, and so I think we can check all those boxes with rehabilitation in general, but virtual rehab seems to provide the same benefit as a facility-based rehab program.